Here. Um, so I'm going to start with a policy question, Mr. Ishrak. Healthcare reform.
Yeah.
I mean, it appears that you seem to be for expanding global access to healthcare.
Sure. Yeah.
Which seems to be the basic tenet of President Obama's healthcare overhaul, expand global access. But it also has put some pressure on medical device companies as a whole. What is your... How do you see healthcare reform as it's being done here in the U.S., and what would you change about it if you were the one in charge of it?
Well, look, I look at healthcare reform in a broad perspective. First, we have to operate and succeed in every country in the world. Okay? And every country in the world has a different healthcare policy. And so we have to provide products and we have to provide strategies so that we win in a broad variety of policies, almost any policy that there is. So we've got to think in more general terms as to our strategies. And when I think about that, then there's like three things that all healthcare systems want to, in the end, achieve with varying degrees of priority depending on where they stand. The first is they all want to provide better care. Everybody wants to provide better care for their population in terms of better outcomes, fewer errors. People want to stay in hospital for less time, and so on. Less side effects, all of that. People also are very sensitive about cost. And in the US, it's blatant in the sense that the cost as a percentage of GDP is exceedingly high. In other countries, it may or may not be that high, but in all countries, it's a point of sensitivity because even where it's not high in terms of GDP, their population may or may not be able to afford it to start with. So cost is another factor there. And the third is you need to provide health care for people who don't have health care, otherwise it becomes a social and political problem. So these three things have to be achieved in every country. How you exactly do it depends on the specific political circumstances and history of that country and how they organize themselves. So as far as we're concerned, as long as we work on programs that clearly provide better quality, lowers cost at the same time, so we're always sensitive about cost, and at the same time provide technologies through which better access is provided, then I think those are the right strategies to win in any healthcare system.
Okay.
And the specifics of the U.S. are the specifics of the U.S. and that's complex. But in the end of the day, these three things have to be achieved in the U.S.
Well, that's the thing about the U.S. where, before medical device companies never really had to think about cost, right? Now you have to.
Yeah,
that's a huge philosophical change and operational change.
Well, I don't know if that's truly fair. We didn't think of cost tactically. In the end, we were always thinking of providing better quality. And when you provide better quality of care, in the end, long term, you do reduce costs because there's less hospitalization and so on, and people, live better lives. And through that, the overall cost is reduced. I think the sensitivity to cost was very macro level. I think what this has done is it's shown that just thinking macro level is not pragmatic, and that you've got to think of it in a very specific fashion. And I think that's what this is forced, and I think that's healthy, and I think that's required, and I think that makes it more efficient. It makes us help prioritize our programs in a better way, and it forces us to think a little more creatively about providing better performance and lower cost at the same time, which every other industry has done. So I think it's the right thing.
Continuing on that theme, you've talked about global markets, and but whenever you talk or other people talk about global markets and providing care there, people automatically jump to the conclusion that you're talking about building cheaper products. You said that that's not the only thing. Can you talk about what are the other things that you need to think about? Because generally people think that masses there cannot afford the type of therapies that you are coming up with. So what other thing besides price should Medtronic focus on?
You mean as we try to provide access around the world?
Yes.
Well, first start building the infrastructure for people who can actually deliver the care.
What do you mean, build hospitals?
doctors, educate doctors.
Okay.
Okay, like our implantable devices. The people who actually implant them, electrophysiologists. In India, for example, there's a very small number. I don't know the exact number, but it's a handful. It's in the teens. Numbers of electrophysiologists serving 1 billion people. While in the US, there's 10 times as many serving a fifth of the population. Okay, so people just aren't available to be able to execute that technology.
Okay.
An awareness issue of an acceptance culturally that certain things happen because people just get old, and there's a lack of education and just awareness that certain things are possible. So there are basic awareness and capability infrastructure that can be built to service people who can afford it already.
Okay.
So let me give you the most striking example, and this is just by way of really by way of illustration. It's not a practical thing right now, but by way of illustration makes the point. The pacemaker that was invented here, 50 years ago by Erlbakken was essentially 2 transistors and about 10 resistors. Okay. And that worked as a functioning pacemaker. That helped people get better. The cost of that kind of configuration electronically today will cost about 50 cents.
Okay.
Okay? So clearly, cost is not an issue if you wanted to make something like that. And there are people dying today in the world who don't have access to that simple technology, which today, like I've stated before, is in museums. Now, it doesn't have to be so big anymore. It doesn't have to have that packaging anymore. It can be far better, made much more simply, targeted for that population if you so desired to do it.
Okay.
The problem is, even if you made it available today, there's no one there to do the implant.
So training people.
Training people, or people don't know that they need this.
So how do you plan to do that? I mean, you have separate educational programs. You fund universities.
Well,
how do you do
the way we plan to do this is we're starting a program already where we're looking at our own product lines, therapy by therapy, look at what the penetration of that therapy is across the world, and look at the most blatant examples where there are gaps in what I would say entitlement between the penetration of that therapy in certain countries versus, say, in the developed world.
Okay.
And then find out again, therapy by therapy, what are the specific barriers to adoption. Is it awareness? Is it cost in some cases? Is it training? Is it new doctors? What is it? And depending on what those barriers are, we will construct programs to help bridge those gaps. And we think that cost will be a factor, but that'll be only one factor. And long before you get to that, there'll be other factors that come in the way, which also require investment.
Okay.
But different kind of investment than making cheaper products, if you like, or making products cheaper.
But let me just, for my clarification, just ask a further follow-up question to that. If you find that the only hindrance to a particular product's adoption is training, what will you do?
Oh, we'll work with the local education bodies to help facilitate the training. There's lots of things we can do.
Okay.
We've got expertise in clinical research. We can provide that the centers of education in those countries. We can work with the educators to see what the best methodology is. We can also, in many ways, make our products simpler.
Okay.
So they don't require that much training, but I don't know that yet. That depends on the specific product, whether that's possible or not. But that could be an avenue too.
Okay.
The point is we've got to isolate, is it training, is it awareness, is it cost, is it culture, what is it?
Okay.
And then we've got to decide, well, what segment of the population can afford this anyway?
Right.
Because there's large middle classes, particularly in India and China, those populations alone are the size of the U.S. entire population.
Right.
Where cost is not a factor.
Right.
And so, just by addressing that, we can make some progress.
Okay.
So I do think looking at this thing product by product, country by country, in a very, very granular fashion, and then prioritizing our actions, and then taking those specific actions is the right way to approach this.